You can go on, Dr. Fatma.
Did you hear me now?
Yes.
Now it's better. Now it's no without echo. Yes.
Okay, fine.
You can go on. خلاص. We will mute ourselves.
Okay, Dr. Safa, would you please go ahead and start our session?
Oh, yes, yes, of course, of course. Well, I'm really happy and delighted to be between and among you all today. There's some friend I already know, my dear Dalila from Morocco too, and there are so many among you that I heard and heard from and respect from far since years. Dr. Hala, Dr. Parol, Dr. Ibtisam, and Dr. Fatma. I'm a member of Mayon board since some few months. And I heard about your work, and I really admire you all. Well, today's session, we will make it a special session because we are special. We will not speak about ophthalmology. We all know what is glaucoma, what is refractive, what is cataract. We want it to be a friendly session, a dynamic session, and a beautiful session like all of us. So I will start by introducing myself because many of you don't know me as I don't know you in person too. I'm Safa Jihad. I'm 41 woman, Moroccan woman, and I'm married since 20 years. I have 3 children, 17, 13, and 7 years old, 2 boys and 1 girl. And I'm the third of a sibling of 4. I have 2 sisters and 1 brother that I adore. I lost my daddy years ago, and I have my mom that I entertain with her, a very special relationship. I'm trying to see her nearly daily. In spite of all those details, those boring details, I'm an ophthalmologist. I worked in the public sector for years, 10 or 11 years. Then I left and I decided to open my own clinic, my small own clinic. It's not a clinic like you imagine. I worked in many cities of Morocco with the public service. Then I opened my own office in Casablanca. My subspecialty is cataract, refractive, and keratoconus. Why am I telling you all those details? Because I believe that each one of us has those tiny details in her life that make her what she is really. It can make us sometimes impulsive, sometimes nervous, sometimes happy without reason, sometimes sad without reason. And I want to make this session to allow all the attendees, the women attendees, to maybe to find themselves in the journey of one or the other of each of us. So maybe we'll start by, and maybe we can allow to the man, the male also, to see their female colleague under another prism, without gloves and je sais pas quoi, Charlotte. We are women. We have lives. And we deserve to be here fully. So let's start by a round table. Maybe we can introduce ourselves to know each other better. Let's go. The stage is yours. Go ahead. Start by maybe Dr. Ibtisam.
Yes. Ibtisam Mohsen Sajwani from Sharjah, United Arab Emirates, working in Al Qasimi Hospital. The oldest in my between my sisters and brothers, 3 sisters and 1 brother. One of my sister is, as you said, she likes mountains and go for hiking, and now understand how is enjoyable going for hiking, being in the nature, away from stress of ophthalmology, medicine, and any stress in life. I'm married and I have 4 children, 14 and 11 years old, 7 to 8 years old, and 4 years old. I know that's not easy. I
unmute myself just to congratulate you to survive after 4.
Yes.
Yeah, and to be able to work, because I have 3. I'm not so far from you, but I know that it's not that easy.
It's challenging. It's challenging.
Yeah.
but
Yeah.
alhamdulillah.
Yeah, ربنا بيساعد.
بتوفيق من الله ربنا بيساعد.
God
أيوة.
helps. Yeah, God helps. So what's your subspecialty, Dr. Ibtisam? Tell us.
Retina and cataract.
Oh,
Medical
you go
retina
deep
and
inside.
cataract.
So
Again?
you go deep inside.
Yes.
Retina.
No, I like
refractive.
retina. Maybe I like retina. For me, maybe I'm يعني not much fond of refractive, but I really like retina. Maybe because in my university, when I did my ophthalmology subspecialty, it was a very big center of retina. For rare retinal diseases, even Professor Hoz in Germany. That's why maybe I had a great exposure to retina and I like retina.
Nice, 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 nice.
I think many people in Al Qasim Hospital, they like it.
It's a hospital specialized in retina, or you do all subspecialties there?
We have a number of specialties, not all of them, but retina is one of the main specialties in Al Qasim Hospital.
Nice.
Dr. Fatma can tell us more about that. Maybe we'll give her the stage now.
Yes, if she
Dr. Fatma?
wants, you'll be welcome.
Okay, Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. I'm Dr. Fatma Ibrahim Al-Amiri. I am from United Arab Emirates. I am from Sharjah. I am ophthalmologist. My interest in retina and uveitis. And I joined the Al Qasim Hospital since 1996. And mostly I am the senior ladies in my department. Now, after Dr. Thuraya, she was our head of department. And I'm married. I don't have children. I spent my life with my mother and father, and they passed away. Allah yarhamhum. And my mother, she passed away 4 months ago.
Oh, we're really sorry. We're really sorry. You know, that's why I told you that there are some tiny details in our lives that make us sensitive. Yeah, it's
Really, my mother and father deal with me like they are my son and daughter, and I am their mother. يعني بس
yes.
الله يرحمهم إن شاء الله ويغمد
الله
روحهم
يرحمهم ويرحم أمواتنا جميعا يا رب.
إن شاء الله. And really, I interest in my field. I'm doing well in my field, and I hope everyone like me to be around. And in Al Qasim Hospital, we have around 10 doctors. We have different specialty, and we are tertiary hospital in Northern Emirates. And we received all the cases from Northern Emirates and from Oman also, and some surrounding Gulf area. They are coming to us. Really, we are very good in retina treatment. We have a retina surgeon, and we have retinal medical also. And among United Arab Emirates, we are one of the best center in government sector.
Good.
My hobby is really, I like to read too much. I like to travel. But
I was looking before speaking to you. I was wondering. I was really thinking, what are my hobbies? I didn't found any hobby. Any really. It was so sad.
Ophthalmology is the hobby.
I swear.
I think nobody have a newspaper in their home except me till now.
And the paper version of newspaper, not only newspaper on the tablet.
Newspaper
Oh,
every
no.
day.
You are an addict. It's done for you. You are an addict. So I was, I had in 28. I was working. I was still doing my fellowship in the hospital here in Morocco. And I begin to have some syncope. I don't know what is syncope in English. Syncope.
It's the same. It's called syncope.
Nice. I get the syncope. And when they did the whole assessment and so on, they found nothing. I did it once, twice, 3 times, and they found some trouble in my heart rhythm. So the doctor, I went to France. I did so many, a battery of exploration inside. Well, I will tell you that after Google it. I will tell you what is it, electrostimulation. So. Yes. And after when I came
I have the same thing.
Oh, when I came back.
I have exactly the same thing.
The cardiologist, I was in rest. I was not running or nothing. And my heartbeat the rate reaches maybe 120. at rest. So it was, and I was doing like this while sitting without any effort. So my cardiologist told me, tell me what are the pleasing thing that you do in your life. I told him, and I had two children at this time. Told him when everything is okay, when I have no problem at work, when my husband is happy, when the children are okay. Told me, no, I'm not asking about your tasks and your duties. I'm asking what's your things that make you happy. Do you like shopping? Do you like traveling? Do you like doing your nails? What do you love to do in life? And I found that it was nothing. Your problem is just here. Try to find something that make you happy. When you find this thing, maybe it will be the window that's the bad things go through. And I really want to invite Dalila, my friend, to speak about her life, because she had one turning point in her life that's make her being total different person, and it was a health person, and we will invite her to speak about herself. She will not like me because I know she will struggle with her English, but she will help you. Just be yourself, okay? So Dalila, we hear you.
Thank you, Saba. Hello, everybody. Masa Noor. It's a real pleasure to be with you this afternoon. I'm Dalila Asba Idrissi, 48 years old, married, and mother of two teenagers of 16 and 14 years old. I'm one of the exceptional women that we all are. Please, a great
Yes,
fan.
thank you.
And especially running and trials, coach and hypnotherapist, ophthalmologist specialized in inflammation and ocular. I also practice cataracts and glaucoma surgery. I work in the liberal sector in Casablanca, Morocco. I'm happy to be with you.
We are also happy. She got medals. She does semi-marathon. She runs just like we are breathing. She can run without feeling. She loves running, But you had a health problem 10 years ago, I think, or something like this.
In 2018, during the Congress of French Society of Ophthalmology in Paris, I had unexpected respiratory distress. I've immediately been taken to the closed emergency hospital, and I was diagnosed with pneumothorax of the whole lung. The etiology of which was diaphragmatic endometriosis, a very rare diagnosis, only 7 cases described in medical literature, which need around 3 weeks of hospitalization in intensive care.
In France.
In French, yes, in Paris.
And your children were still here?
In Morocco with my husband. And being taken to the operating room 2 times. Those moments were some the most difficult moments of my life. I was alone by myself. I had to deal with this situation alone for the first 24 hours before my husband joined me. I had the chance to be hospitalized in one of the best structures in France, and my greatest luck was the surgeon who operated me. It's Professor Jancovici, to whom I would be very, very grateful life with the just exceptional human quality. Before this incident, I was an anxious and hypochondriac person. My anxiety ruined my life for many years. But after this incident, I made stop of my person, and I've realized that nothing happens by accident. I invited the desire so much that it presented itself royally. I realized for the first time in my life that I'm responsible somewhere, and realized that it's really urgent that I change by my beliefs, and that I do personal development work on myself. And it's from there that my life has changed wonderfully. and that I became my best versions, that I continue to improve every day.
Great, that's great. You passed the death passed just near under your nose, just like this.
Yes.
Alhamdulillah. Thank God. Thank
Alhamdulillah.
God. You were running before, or you began running after?
I running before, but after I ran more.
But
It's
you
like therapy for me.
you had this problem when you were running after ophthalmology in France. You had this problem, so stop running
Yes.
after ophthalmology.
Uh,
Let's invite Dr. Parol and Dr. Hala to speak a little bit about themselves. It's yours. Go ahead.
All right. Well, I'm Parul Ishpujani. I live in North India. I work in the government sector here, and I'm 45 years old. It's been 15 years since I'm working at my current place. I'm a glaucoma specialist, but I love to teach. So I have graduates and postgraduate students. So teaching them is cathartic for me, because I think when you go into depths of what you know and what you don't know, it really brings out a new aspect each time. And every student is different. And I've realized that knowing the student or the young doctors, it gives you a lot of insight into what's happening around you.
Makes you stay young when it makes you, at least your brain stay young with when you are teaching. We are frequenting young people.
Yes. And well, as you said, I don't really have any hobby which I can really talk about, but I do love to write. So I did find out my passion in writing books. It may look like ophthalmology continuing, but trust me, it's not. It's beyond that. When I'm crafting something and writing or editing something, it seems like as if I'm creating a new piece, a new attire. So that's kind of satisfactory for me.
Yeah, because those are your babies. They were nothing before, and after you can see it in front of you. This is just magic.
Yes. So I'm divorced. Did not have a great or a long marriage, but I realized that it's better to be happy. I realized that it's better to be happy and take care of your own self. And there is so much in the world to give and to accept. It's just that I have to be receptive towards things.
That's it.
Yes. So yeah, that's essentially about it.
That's wonderful. That's wonderful. You know, I just believe in something. We are happy. Maybe it's a feminine quality. We are happy when we see people around us happy.
Trust me. Yes. So even coming to this group, it's hardly been 15 minutes, but the joy and the warmth in everybody, it brings out the happiness.
Feminine quality. I think that male doesn't have this quality. They are happy when they are in peace with their mind. They're happy. But females, we can be struggling, tired, doing multitask. But when we see a smile here or there or something, thanking us for something we have done, it's erased all this pain and all this suffering that we had before. And so we're seeing the smile on your face, and you have a baby face. Have somebody tell you that before?
It's all the fat that is plumped it up, but whatever it is, I'm really thankful to life. And life has taught me one thing: we need to be thankful for a lot of things that we take for granted. And whether it's a health scare, whether it's the loss of a parent, whatever it is, it's all been there in the master plan. But we got to stay motivated to contribute every day and to be blessed with whatever we have. Yes. So yeah, these are life lessons which we learn with age. Yeah, I'm happy and blessed to be in the company of all of you. And
it's a great pleasure to share this moment with you. Dr. Hala, it's all yours now.
Thank you. I'm very, very happy to meet you all, really. So I'm Egyptian. I'm a professor of pediatric ophthalmology in Cairo University. I was born in Egypt, but my father was a urologist, and he moved to Canada, and we moved with him when I was 9 years old, and so I grew up there. My father became a very world famous urologist, and he groomed me or wanted me to follow in his footsteps and become a doctor. And this is what I did. I did it because I wanted to be like my dad. And I married again an ophthalmologist. He's a retinal specialist. Between us, we have 4 kids. We brought up 4 kids together. And I have exactly the same problem as you. I get AF when I'm stressed, but it's only related to stress. My last episode was just 4 weeks ago. I was doing glaucoma, a GAT procedure for a one-eyed boy who had repair of retinal detachment. He had silicone oil in the anterior chamber.
On the good eye? On the good
the only eye. The only eye. I was doing the glaucoma surgery. His pressure was hitting the roof, and I developed AF on table while I was doing the surgery. I continued the surgery, but then I was moved to the ICU, and because of really severe AF, my heart was beating at 160 beats per minute. And as they were taking me away, and I thought, my God, I'm really sick, but had I known that this was going to happen, would I not have done the case? And I said, no, I would have still done the case. So
that's really great from you, because something we hear from our environments: manage yourself, try to be less stressed. Those kind of advices that means really nothing for us, because
yes.
We don't choose to be what we are. We are like this. When we are involved in something, we do it with our hearts. We cannot stop. And when we stop when we cannot move. That's the really only thing that can make us stop in our place and not move.
Yeah.
But, the pediatric field is very بياخد مننا كتير.
It is.
Because we have a big compassion with children.
Yes.
So you are emotionally, you are at zero, and you need to take from your energy to give it. See, this is very difficult. There are some specialties that I could never do.
Mm-hmm.
Like oncology, pediatric oncology. It was really traumatic. I had the training in a pediatric service while I was in the medical school. And I told myself, Safa, you will never do something related to children. I cannot, my heart, I feel it squeezing when I have children in front of me that I cannot help. I will help, but he will suffer while treating him. It's difficult. I understand you, but having this attack in the OR make us put in the question to us, am I really obliged to continue this way? The answer is...
Again, I don't have hobbies. So this is my hobby, working, treating people and teaching. I agree totally that teaching is so rewarding and so gratifying. And when you see you give information to someone or knowledge, you pass on knowledge, and you see the recipient's face and how grateful they are. Again, it's extremely gratifying. I love teaching, and maybe at the end, someday I will stop surgeries, but I think I will continue to teach.
But maybe we can ask, Dalila, I want to ask you a question. Tell me if we can find in our work enough pleasure to make it be our hobby. If we can
Uh,
take this pleasure, that's the satisfaction in front of patient, it can be enough for us. I know that you do personal coaching and something like this because you were really deep and you come in the surface after. But can we find in our work this energy that can make us fulfilled? I'm okay, I don't need anything more. Or there is a limit between the duty, le devoir, and the pleasure. Should it be a barrier and a difference between the two fields? If you block and you stop on some words, maybe I can help you, but still it's in French.
Really, yes, I improve pleasure to run and to work. The real problem is the lack of self-esteem. What's this self-esteem? It's quite simply the reputation I have of myself. We always say to ourselves, I'm not good enough. We have this permanent impression of not being enough beautiful, enough rich, enough competent, enough capable. And the second part is the fear of being rejected. I will be rejected, and this fear of public speaking and work. Good self-esteem give good self-love and self-confidence and the ability to work good, to do sport, to live good.
So if I understand what you are telling me, we should really be happy with ourselves.
Yes.
To have enough energy to give it around us.
Yes, it's. I invited you to do a job of your person. We must practice development personal. We study a course of medicine. We study a lot of things, but nobody study how our mental work.
And we need our mental to stay working, and we need our mental to stay alive because
how to be happy, how to be peace, how to be good in work, in life, how to have this equilibrium.
Yes. Yes. I just knew something that made me really happy, and I wanted to congratulate Dr. Hala for being nominated for the Women of this meeting. It's great, well deserved. We are happy. We have among us the women of this meeting. Congratulations!
Thank you very much. It was an honor and a big surprise. And I don't think I deserve it at all. I really don't.
You do. You really do. There's no doubt. We all deserve to be this woman because you work, you give you all what you have inside you, and you do it with the fair. So we need to hear this. You deserve, you are the best, and you deserve, you are the best. That's it.
Thank you so much.
Dr. Safa, I want to just comment on your the mark line between duty and our
pleasure. Yes.
For example, I will speak about myself. I'm doing my duty as sincere way, as I happy that I'm serving our people, giving the best and attention. What can I give to them? And my pleasure really when start in 2011 when I joined the Red Crescent and I as volunteer ophthalmologist. Till this moment I'm working with them and I have 2 clinics weekly and in each clinic I see more than 20 patients and really I try to give all my effort to these people to provide them with all treatment. To help them because they are poor people. We provide them with the injection.
You have poor people in the Emirates too?
It is not Emirates nationality expert from Pakistan, from India, from Iran, from Syria, from Arab countries. Yani. from Africa. We have a lot of them. This nationality, they are coming and seeking the help from Red Crescent. And
Yes.
really, I am pleasure that I among these people I'm providing them very any free service, and we can help me with my colleague and Qasmi Hospital. Also, they are coming there. We provide them with we do for them investigation, we do for them diagnostic image, and some of doctor I sharing with them my idea and their consultation. Really, I'm grateful to everyone around me because they helped me to provide this service to the people in my country.
Yes, but
This is
yes,
my
this is,
pleasure.
yeah, you could join the both pleasure and the duty in the same source. What do you think, Dr. Ibtisam? What's your point of view here?
I agree with Dr. Fatima. Actually, it's a great pleasure and happiness when you deal with the patient in the clinic and when you help each patient and relieve the complaint. And when they come back, grateful that you cured their disease or reduced their suffer, that's make you very happy. They
Sure.
come thanking you, and they become with time actually really like customer or more than customer is part of as
Member
part of
family.
your far family. Yes, they will come just to say hi.
Well,
They will
I
miss
just
you. They will.
I just want to stop at this point, and I want to ask you if we keep this state of mind, so keeping and putting all our psychological energy in this job, what if, and it will come late or early, this job we will not work all our life. So after years, 10 years, 20 years, 25, 30 years, we will stop. From where will we get this satisfaction? Well, I want to ask you if we are not obliged to, from now, while we are working, to create another center of pleasure and of
Yes.
now, while we are still active. Dr. Hala, you and I, and Dr. Parol, Dalila, I don't speak about her because she found her ecstasy otherwhere. So
Yeah.
tomorrow she stops working. Maybe she will go running. After she will do spa, she will maybe read. But we are focusing on just one and only thing. It is not a bad way to see life. We should it should be maybe a turning point in our life today, and to ask ourselves maybe we should do another thing, maybe something caritative things far from ophthalmology, because if we do it with link in ophthalmology, we will put the duty in it.
Actually, you are right. You are right, 100%. Recently, I'm trying to create something to make this change point, but it's difficult. It's not easy.
Très
I
difficile.
need to have my happiness somewhere else, other than the job and the family. Even the family, you should have something for yourself to
Family
make
will leave.
yourself happy.
Family will leave. Children will grow and will leave.
Yes.
And
Yes.
I have my big son. I have 17. So now next year he tell me, Mom, I don't want to stay here in Morocco. I will leave. Ciao bella. I kiss you and I will call you from time to time. Okay, I'm happy because I will have less
Responsibility.
Yeah, less responsibility. But the second will follow, and the third will follow, and they won't be here. So we will. Safa will stay with Safa. And Ibtisam will stay with Ibtisam, and Hala with Hala, and Parul with Parul, Dalila with Dalila, and Fatima with Fatima, and so on, all those attendees who are hearing us today. So maybe we can work on this now when we have the still energy. Don't give this full energy to just at one and the same. You know, we all have a religion, okay? And we know that in our religion, Muslim, we can consider just as the work as a practice of our religion. العمل عبادة عندنا in our religion. So we can get the satisfaction from this side, but we will not work all our life. And we will not spend all our life doing just duties. So let's find something a bit far from ophthalmology to have some ecstasy. Huh? Ecstasy.
To build hobbies, really to build hobbies, like Dr. Fatma, reading, sports, taking care of our health. Hiking is a very beautiful, enjoyable thing. Very, very enjoyable.
I was asking
You have nice
Dalila.
weather in Morocco. You can enjoy.
Yeah,
it.
we have nice weather. Yeah, and we have nice
And
places.
nice mountains, nice
And I
mountains.
invite you all to come. We have many congresses, and next year we will have congresses in English. We are improving ourselves. We are apart from the مستعمر. We are leaving the. I was asking. I met Dalila last week in a meeting, and I was asking her, "Do you really find a pleasure while running, or you do it as an obligation and a duty?"
No.
No,
It's a
no.
pleasure.
When I don't run, I feel bad. I feel bad.
Really, I am. If I'm not work 1 week, I feel I am not
If
okay.
you don't work, يخرب بيتك احنا مش
No,
عايزين
work. امشي.
Okay. احنا بنتكلم عن we are telling you to go far from work and you tell me work.
No, I'm working. Daily base, I'm working.
Yeah, that's good.
Finding balance, it's everyone's dream. There is not magic recipe, and you can't be perfect everywhere. In fact, we all have the same ingredients that we have to mix according to our needs of the day and the event that arise. The recipe that suits me personally, it's running, it's sport. It's my biggest addiction. It allows to
you run how much miles a week, or how much
3 times for week, 4 times. When I am happy, I run. When I am angry, I run. It's allowed to go me into state of hypnosis, which allows me to do some emotional self-cleansing, and which recharge my batteries to start beautiful day, work, and boost me. It's like in real life. Sometimes I start by training with the ball in my legs, but I don't let go. Mother discipline is needed, and the job must be done. Some days I end up like a butterfly with stars in my eyes, and sometimes I end up off my knees. I say that how it's today. It's a mini training for life. It may seem strange to you, but that's how things go in my head. The job must be done. Of music, painter, hobbies is more important. Safa is Safa, Hala is Hala. Ophthalmology is just accessory.
Yeah. Dr. Hala, what's your point of view?
I agree. I totally agree.
Can we be good everywhere? Because that's what we are looking for.
Yes.
All of us. Can we be good everywhere?
Well, we should try to be again more balanced, and balanced is the right word, to have everything in the right quantities and not go overboard with work. But even though I say that all the time, I'm still unable really to do it. So after talking to all of you, what goes in my head, oh my God, I need to get a psychiatrist or a psychologist to help me.
That's the first step for happiness. Go ahead.
I need someone to really take care of me and tell me how to do it.
You will be friend with yourself. This is the first step.
Yeah.
هنبوظ الدنيا خلاص.
Yeah.
Dr. Parul, can we be good in all our feature of our lives?
You have to decide that you cannot be 10 everywhere, but at least try to be 8 at most places. And taking care of your health is something that we have to do consciously. I have Hashimoto's thyroiditis, and I have gained a lot of weight because of that. But if I continue sitting on my laptop and working and writing papers and books, it takes away the exercise element altogether, and it's a downward course. So I'm the only person who's going to help myself. And I
That's
have to recognize that.
Oh, I think that it's a bit. We are facing multiple duties, and the duties the only duties that we allow ourselves to not be perfect is the one in front of ourselves, the one of ourselves, the duty that we have against ourselves. So we don't allow us to be a bad doctor, we don't allow us to be a bad daughter, we don't allow us to be a bad wife, we don't allow us to be a bad mother. We do our best in all fields, but when it comes to us, we say خلاص عديها, it's okay, today it can be fine, I will do it later. It's years and years in our life, and it's over, it's done.
You very beautifully put it, because I may not be able to run a marathon, but I've got to make myself walk at least 10,000 steps. So yes, it's the realization that has to come, that you got to move.
And it will be your great success.
Absolutely.
Because you do it to yourself. This is the present that you give to yourself.
Absolutely. And that's what this body is, our place of worship. And we need to take care of it. And that's something we all need to remind ourselves.
Yes. We agree. So we won't speak ophthalmology. Don't look at me like this. But maybe we can make a sort of brainstorming those 10 last minutes. Maybe we are about 55% women in the workforce in ophthalmology. So we are the majority. But till now, just between 5 and 10% reaches podiums. Which is a real inequality. So being you all speakers and well-known person in your fields, what do you think the cause of this inequality? Is it less is it from us? We don't make the effort to be present enough? Or is it just we're waiting for the circumstance to be okay and to push us in the? Let me. What's your point of view about this topic? Why we are not enough as multiple as men on podiums? They're better than us? Don't tell me that. I'm not sexist, but I know that we can do all what they do. Maybe I have one feeling that man, when he began his working day, he starts from zero. But we will start from -10. So we do more efforts because we deal other tasks. We manage many things in our brain before telling Bismillah and we start the first patient, for example. The men, I think that maybe they can be more active. I don't know. I don't want to say that, but I think that we can get more place in podiums. But I don't know why it is not the case till now.
But I actually think we're improving. I think that the number of women is increasing all the time, and at least in pediatric ophthalmology, because most of the pediatric ophthalmologists in Egypt are women. And so I really don't see that. I guess in other fields, this is more obvious, but I think it's improving though.
Yeah. If we see the podiums, those 2 or 3 years, and we compare it with the 10 or 20 years ago, we will really be thankful. That's sure. So we can be better, I think.
Because as you mentioned, the man they start their day with a 0 effort, and we start with a 10. because before when
Mindfulness.
we get from sleeping, we think about family, what we should go today, what task we should provide to the family. A lot of the thing around us. But
Yes.
mainly, they will get from sleeping, dressing, going to the job, and take coffee and starting their first patient.
Yes.
I agree. I agree. I agree.
Also, our society, it is the man society, يعني مجتمع ذكوري.
Mm.
They have time to go and call each other, come to sit on the such coffee and to discuss this point, to start to do some
all
lectures.
all the environments should be made to make him more comfortable.
Yeah, and as we are ladies, we are going back home. We have duty. We have somebody have children. They should look about children. They don't have time to think about what they will do next step in the rest of the day. For
That's
this
it.
reason, the man they have more time to think, more time to be very obvious in these lectures and to prepare these things. And
Read newspaper
I'm
like you.
anyhow, yeah, but we should have time management. If you have time management and you can manage your time, you can do whatever you want to do.
I think it's not about time, all about time management. I think that we are victim of
Education.
ourselves,
Society.
society, and even our character as well. We are really afraid from criticism. We are the more one who critic the woman is the woman itself. يعني أنا how do I look? How did I speak? Was I fast? Was I? And this is make us afraid from the public.
Yes.
Maybe they are less less stopped by this fear.
Doctor, the lady is she shy? She feels shy sometimes to come in front of the man and speak. Some of the ladies they are refusing to come on the audience because they say we feel shy to come in front of the man and to speak.
شاي كنت قعدت في بيتكم من يومك شاي.
والله في ناس they are some very excellent doctor, but they don't want to go for show up. They don't
No,
like to be in show.
Okay.
This is
Do
one of the reason, yani.
Do you think that there are some patients who would like to be operated by a male surgeon as compared
Yes,
to a female
of
surgeon?
course.
Yes.
Here in Morocco, they prefer male surgeon in every specialties. Don't you think that, Dalila?
Yes.
Yeah, they
Yeah.
choose men first. And they ask us. They come, we do the diagnosis, we explain, we had that. Okay, everything is okay.
All is
Okay.
good.
And
In
all is
surgery?
good. And I tell me, no, the surgery. Will you operate me? You?
Yes. You,
Yes.
doctor, you are young, doctor. You operate.
Yeah, some patients they are do.
For us
They
also.
are who will do operation, and some people, if, for example, will you explain to them and you tell them everything? Then I think they're not trusting you as a lady doctor. I'm calling Dr. Ahmad, he's the eldest one in the Hada. When they see the white head, خلاص, what Dr. Ahmad said, it's
The
the right.
white head. He should have a mustache, white head, and it is respectable.
They trust him. But anyhow, and really, my patient, they like me to do for them operation. They ask me, will do operation?
Thanks God, we do too. But it's we are facing this category, and I thank you for this question because I thought that it was just in our society.
It's
And
there
I,
everywhere.
oh, that's
Everywhere, even in our hospital, our patient, they ask him, who will do operation?
So 10 years back, I had to lay my credentials on the table so to convince the patients that, I can do a good job. You just got to give me an
Oh.
opportunity. Now, as I'm getting more towards the middle ages, and so they now think that she has enough experience to, take care of us, their surgical confidence is increased. But the fact is that it has not been an easy going. You have to prove yourself even to the patient, let alone our own colleagues, to show our worth. So that's like an extra job which women have to do as compared to our male counterparts.
I will ask another question. If the pilot is the woman, you are trust to travel with him? To fly
Oh.
with him?
Yes.
maybe I
of
will
course.
think.
Yes.
Maybe I will think twice.
No, I think I definitely.
Oh yes.
I think I would always, if I see a pilot who is a woman, I would remember myself. And I agree with everything that you said. When I started out, it was difficult to convince a patient that I will do the surgery for them. And there was very little room for failure, very little room for making mistakes.
Yes,
for us as women than as
unforgivable,
men.
because it was you.
Exactly. So it was double hard for me than a man to become known for doing surgeries. I thank God I don't have this problem anymore. But because of that, if I see a woman driving, being the pilot of the plane, I would get on the plane because it's been so hard for us. So
Even young and small ladies, you trust her?
If what?
And small lady and very small.
No. She will. Dr. Hala will trust. Yani if she's not an elderly woman, yani, without experience.
doesn't have to be an elderly woman. If she's qualified to fly the plane, I'll be on the plane.
And I think that last when I was in Saudi, there is an Omani Airlines. There is one pilot. She's very young. Around I give her 16 years old age.
Oh.
And she's told us I am the pilot. I don't have a people travel with her.
You delayed the trip. خلاص قلت لها انا راجعه بيتنا. I'm not traveling anymore. No, but
Well,
no.
you said we asked so many questions. Are we looking good? Did we do it the right way? So everybody is anyway so self-critical about their own selves that they will do a good job because they would have reevaluated themselves so many times that
Yes.
from their own side, they would have tried to reduce the room for error.
Yes.
So I would, that's why I trust a woman, because the
Yes,
amount
because
of effort they would have put in to think and make a plan would have been way more than a man. Yeah.
sure. I'm okay with you. I'm okay.
That's
with you.
true. Very true.
But in my opinion, the one and the only cause that blocks and slows down most women comes from themselves and their own beliefs. Of course, we live in different society, but a common factor all over the world is the inequality between men and women that our parents instilled in us through their education. And we have here so much about it that is has become a truth in our heads. We have all here replicas of this kind. It's a job for men. Only men can do this kind of task. Men are better in this field, etc., etc. Moreover, is goes back very, very far. Women did not even have the right to schooling. This is the greatest discrimination. Unfortunately, this is still the case in certain regions of the world. And it's true that the woman is multitasking. She must fulfill her role of mother, doctor, nanny, psychologist, drive, cook, coach, which exhausts the majority of women. And sadly, it makes their task 100 times more difficult. When a man is single task, once he leaves home, he focuses only and strictly on his work. He forgets all the other roles in his life, which facilitates his evolution in the socio-professional scale, I think, in my opinion.
Yes, I totally agree. I don't know what about the Emirates and Egypt, but we still here have many parents that doesn't send their daughter to school here in some rural places. So we're still facing some inequalities, but as Dr. Hala said, things are improving in a very high speed, and we are good. We will stay positive. We are good. We are making our voice heard, and we are winning challenges. And maybe we don't need to be fully like men. Maybe just we need to be what we are, working in our rhythm, working but being recognized. What we really need is to being just estimated at our real value, because sometimes we feel that we are underestimated not because of something, just because of people or men don't see all what we do above work. We do many things and we do work with this thing. So maybe we need to be more recognized and more evaluated. Maybe we have some last words to each one of us to say maybe goodbye. It was a great session, and I was really happy to know each one of you, wonderful women. So I'm gonna let you say bye, each one of you, and I hope that we will meet in Mayom next October, huh? Inshallah, if we are still in life.
Inshallah.
Well, more
Thank you all.
power to everyone. Yeah.
Congratulations once again, Dr. Hala. It's really, 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 I'm really pleased to hear it. I just heard it from Dr. Amri a few minutes ago.
Thank you. I take it as a recognition of my unit of pediatric ophthalmology
Yes,
in
the
Cairo
whole
University,
team. Yes.
not myself.
Of course.
It was great seeing you, and I hope I get to meet you in person really
Yes.
soon.
It's really the same for us. Dr. Paro.
Thank you. More power to every one of us. And I'll take this moment to thank one man, Dr. Mohammed Al-Amri, because he brought us together. So, yes. Yes.
Thank you, Dr. Amri, if you are here now.
Yes.
My pleasure to meet all of you, and thank you for accept our inviting to Kuwait, and inshallah we'll see you again in Mayom and in Kuwait next year, inshallah.
Thank you very much. Thank you very much for inviting us.
Thank you very much.
It was really nice meeting you all, and really that empowered us. When we talk about our personal struggling and our really, it's a personal issue that we have to improve other things in our life other than work. To think about other things other than work and family, actually, other than work and family.
Nobody will do it for us. That's very important.
We have
do
to think about
for
it.
others, but nobody will think for us. So let's think for us for a bit.
Yes. Maybe wait to hear from you next year. What did each of us achieve?
Yes, we will take the challenge, okay? Next year, we'll meet.
Next year, I want to hear it from all of you. What did you achieve in taking care of yourself?
Maybe I will begin walking, and after next year, I will run. Next year.
Yes. At least any sport.
Yeah, any sports. So let's take a picture, a screen. Do your beautiful smile. 1, 2, 3. Yes, that's great. Nice. So we'll.
Thank you.
Yeah, we'll end the session. Thank you all. Bye.
Thank you. Remember that we are exceptional women and we deserve an exceptional life.
Yes, we deserve it. Yes, we deserve it. Bye.
Bye.